VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
VYZULTA is unique because of its first and foremost mechanism of action, really the only one in its class that functions and works the way that it does. Low hyperemia or low side effect profile, and interestingly, it has a high retention rate. So it is interesting when you look at the dual mechanism of action because you're looking at a prostaglandin analog which has been well established within the profession of optometry as a first-line therapy to treat your ocular hypertensive, to treat your primary open-angle glaucoma patients, and to treat your normal tension glaucoma patients. Now with this dual mechanism that exists, we now have this pathway that in addition to providing uveoscleral outflow, we can also influence trabecular outflow as well too. So you're providing two benefits with one drop. In my mind, that just seems to be a logical conclusion to where to start with a number of these individuals.
I think that's the first thing that everybody has to understand is that this is not just another prostaglandin. We have a mechanism of action that works via two outflow pathways. So when I look at someone who is not achieving their goal on a prostaglandin, because most times, 9 out of 10, that's our first go-to drop, I'm wanting to keep them on a once-a-day drop. And when I know that I have something that can do that and deliver two mechanisms of action, VYZULTA is the first thing that comes to mind.
So that's been the holy grail of, in the last 15 years in new medication discovery, is how do we get past just the uveoscleral outflow and also go to the source of the disease. We know from a lot of different studies that the trabecular meshwork is the site of glaucoma genesis, if you will. It's multifaceted, of course, but we know that people that have glaucoma have an intrinsically low level of nitric oxide. And nitric oxide serves a significant purpose in the trabecular meshwork, and in glaucoma we know that there's a decrease of that. And so when I start to think about the mechanism of action of VYZULTA working in the trabecular meshwork as well as uveoscleral outflow, I know that I have a very powerful medication that's truly targeting the nature of the disease.
So for example, with nitric oxide, its effects on smooth muscle, its ability has been shown in numerous studies as what it does to the trabecular meshwork and how we understand how it works. The fact that patients who have glaucoma have a lower amount of NO in their eyes.
So with VYZULTA, we have a new mechanism of action in nitric oxide and relaxing the trabecular meshwork and allowing for outflow through that pathway. Having something that finally addresses that in a robust way made sense for me to give it a good, honest effort in my patient base, and we've seen great success with it thus far.
Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information at VYZULTA.com.